Starting clinic as a third year and even sometimes as a fourth year for different procedures can be a little confusing, especially when you're not entirely sure what you're trying to prepare or what you need to ask for from dispensary. So we're going to start with dispensary and what you need to ask for each different procedure. So we'll start out simple. Also, we're here with our friend Mark. Ryan's back there too, he's being too shy. Get to know your dispensaries. They're a lot of fun and they can make your life a lot easier. So to start, we're going to start with your OD, right? So that's basically the first thing you're going to be doing. So what you need to do for OD, you need to ask for an exam kit and an alginate tub. So just for our purposes here, I mean, they'll get you like a cassette with Explorer, mirror, probe, and all that stuff. And then this is your lab tub. More often than not, you're going to be taking an impression of your patient, especially if they have missing teeth, because then you'll probably be preparing some sort of prosthesis. But at any rate, this is your lab tub. So you get a mirror, you get your patient glasses, so you won't need to ask for your patient glasses separately. You get, well, you don't need triad, but you get a spatula for the alginate and then a buffalo knife. This is a Clue. This is more for dentures. We'll get to that later. So this is for your OD tub, and then we'll get to the paperwork. Second most common procedure you'll be doing in clinic as a third year is some sort of perio procedure, whether it's an adult prophy or scaling and replaning or a maintenance. So maintenance and prophy are the same thing, it's just a different code. So a prophy is 1110, that's on someone who hasn't been diagnosed with periodontitis or has been at periodontitis free for, I believe, 2 years, don't quote me, but if they remain periodontally stable after, I believe, 2 years, so after 2 years of 4910s, they can switch to an 1110. So 1110 and 4910, the same procedure, the same stuff, it's just if they had periodontitis and you did scaling or replaning at a previous appointment. Anyway, so when you are preparing for either of those or any of those three, you want to ask for a Perio setup. So they'll give you a Perio tub, a Perio cassette, which you are very familiar with because that's what you use your first and second year a lot in your Perio classes when you work on each other. And they'll also give you a Perio tub. They may or may not give you a towel if they have enough clean ones, because usually as a third year, you don't know what you're doing and you basically give your patient a shower during the prophy. And they'll also give you a Cavitron and a slow speed for the prophy cup. So this is the Perio tub. You get, again, your patient glasses, a mirror. So the mirror is basically for educational purposes. You will disclose the patient and then you will have them look, and then you show them where the plaque is, and then you will proceed to give them oral hygiene instructions, brushing, flossing, yada yada yada. They also give you anesthetic in the Perio cassette if you are doing scaling and root planing. Depending on the patient, you may need to anesthetize them depending on their sensitivity. Also, while you are up here, I can't tell you how many times I forget this, get this sheet. So this sheet is just their authorization for a care package. So you can request a specific type of toothbrush and toothpaste, and also more often you're probably gonna apply varnish. So the varnish is up here at the dispensary. So get these two things before you leave the dispensary. All right, now to the good stuff. Operative or restorative. Obviously, you'll be doing either composite or amalgam. And you will specify at dispensary composite or amalgam. If you're doing composite, they'll give you a wand for the composite light. So that's basically the only difference. They'll still give you an operative cassette, and you will also get an operative tub. So in the operative tub, they give you anesthetic, they give you hand mirror, they give you wedges for those class 2 lesions that you need to restore, Vitribond, shade guide for composite, your composite gun, and your patient glasses. So also, when you're doing operative, if you have a caries removal reval planned, and it looks like it's going to go into the pulp, I would preemptively get an endo tub. So in an endo tub, they give you UltraCal. So this is calcium hydroxide, which you would subsequently place in the canal after your gross pulpal. and they give you Cabot. That's an alternative to IRM for your temporary restoration, assuming you are going to complete the root canal and do a definitive restoration later. Every faculty is going to say something different to you about Cabot versus IRM. IRM is something you have to ask for separately to check out. So essentially you're getting the endotub for the ultracal. But also what you should ask for at dispensary are endophiles. I would get a 15 and a 20 endophile just in case, and then we can walk over there later, but also get your sodium hypochlorite or bleach. It's right over on the cabinets, if you will, right between endo or emergency and pedo. So we'll walk over there in a minute. So that's it for your regular operative procedures like class 4, 2, 1. Also, if you think it's going to be deep, the faculty will more likely ask you to isolate. So you'll ask for isolation. Dispensary will prompt you for anterior or posterior, and you will tell them which two. And then that's about it. So if you're doing something real exciting like a crown or a bridge, you'll ask for a crown and bridge setup. So they'll give you the restorative cassette that gives you the right instruments you need. They'll also give you a crown and bridge top. And depending on what step you're doing, they'll also give you a PBS impression tub. So the crown and bridge tub, again, hand mirror, your anesthetic. So these are your, well, we'll get to that. And then your alike, everyone's favorite, temporary restorative material. And then, so they give you pattern resin. So the pattern resin is for a bite registration material. So there's a couple different ways you can capture bite registration here in clinic, and every faculty is probably going to tell you something different. Pattern resin is good. It's obviously once it sets, it's not really going to move. You can also use Aluex or Regisil, but just whatever you or your faculty decide. Also, they give you a occlude, so that would be, you generally use it for your RPD try-ins. So you spray the occlude on the intaglio surface of your RPD to show if your RPD framework is hitting too early. So then your PBS impression tub comes with guns, and they'll usually give you 3 kinds of PBS. They give you, and they're labeled. Medium body is what I picked up first, light body, and then I don't see any heavy body. Heavy body is purple. This is different. This says Regisil, so this is one of the bite registration materials I mentioned. So you will be using this for crown and bridge, as well as your final impressions for your dentures. So when you're doing crown and bridge, so if you are taking a PBS impression of a crown, you will use light body and heavy body. So since this tub doesn't have a heavy body, I'm obviously going to ask Mark for heavy body. And then they give you the applicators for the light body. So when you're taking an impression, you assemble your gun, and then you apply the light body around the crown prep itself. You will have already placed your cord and isolated your margins at this point. So you do light body around the crown prep itself, and then you do heavy body around the rest in your custom tray that you should have prepared. And then for dentures, you use medium body. The reason for that is the heavy body displaces the soft tissue a little more than you want. So then if you displace the soft tissue more, then so if you displace the soft tissue, then your custom trays might be overextended, your base plates might be overextended, so then that's just going to create more work for you, trimming down either your custom tray or your base plates. So just keep that in mind when you are doing your denture work. So there are 2 checklists, complete denture checklist and removable partial denture checklist. They are found in both 3rd and 4th year clinics. So more often than not, whatever procedure you're doing, you're going to be asking for a removable setup. you should have your, so obviously like the first step is your diagnostic impressions. So from your diagnostic impressions, you make your custom tray. So at this point, if we're doing a complete denture, you will have your custom tray. So the first step after you have your custom tray approved, you'll have to try it in to make sure it's not overextended. You do border molding. So you ask for a removable setup with a water bath. I guess I don't know if I asked for a water bath or if I just asked for a removable setup for border molding, but just asked for a water bath. And so yeah, basically you get your high speed, which you don't really need. You do get your slow speed, your acrylic fur, and then you get your water bath. So if you are doing border molding, so that's again the step after you make your custom tray. If you're doing border molding, try to set up as soon as possible before the appointment, because you have to put some water in here and set it at 140 degrees. I'm pretty sure they're preset. Usually preset, I'm pretty sure it's 140. I'm pretty sure they're preset at whatever temperature you need. So you just want to put water in it, plug it in, go eat lunch, or finish preparing for your morning patient or whatever. But you just want to make sure you kind of think about that beforehand. So then you do border molding, just depending on how fast you work or whatever faculty you work with, you might get to final impressions. So I mentioned in the crown and bridge video that you do medium body for complete denture final impressions, and I mentioned that medium body doesn't displace the soft tissue and musculature as much as the heavy body, so that is why we do medium body. So you'll also have, you also want, so if you're going to try to do it at the same appointment, cool, but you'll have to ask for a PVS impression tub as well. So then at that point you pour up your final impressions, and then from there you make your base plates and your wax. So that's, you can do that on your own time. There are Dr. Lim's PowerPoints from Complete Denture class are very good guidelines on how to make those. Those are just based on averages. So you just make your base plates. So you would come here on your free time and get a removable lab set up, so you can check those out overnight. And then you can go to that wet lab or go back up to the sim lab and make your base plates and wax rims. So then when you're doing VDO, you'll ask for the same thing. You won't need the water bath anymore, but you will need just the removable setup. And so the same thing from then on. You can either get a Hano torch for each of these procedures. I would recommend try to ask for a propane tank, because those flames are a lot stronger and they heat your instruments a little bit faster. And then basically at that point so then you got like your interior try-in, your posterior try-in. So you're going to be setting all your teeth obviously on your own time. And then your posterior palatal seal, you can do that on your own time. And then the clinical remount and denture delivery. So with that is, I think you're encouraged to make a remount jig. So you use that little beaver tail thing to put mounting stone to make your remount jig before you send it out to the lab. So that's just a way to basically record how you mounted your cast and obviously the arrangement of your teeth before you send it out to the lab. So it's a good way to easily record. So then you want that jig to be able to remount clinically so you can check for any discrepancies, and it makes adjusting occlusion a lot easier on the day of delivery. Also, if you send it to Olson Lab, there's a really good chance they'll make one for you. And that's it for removal.